While experts say the global risk remains low, the outbreak's a warning for us all.
These are basic public health measures to stop these outbreaks. And that's why this is a needless tragedy happening in Africa at the moment.
Aziz Al-Safin, One News.
Pokemano, welcome back. The World Health Organization has declared an Ebola outbreak in the Democratic Republic of Congo an international emergency. That's one level down from pandemic proportions. There have been nearly 90 deaths and more than 300 suspected cases. Uganda has also now recorded 2 cases, with a man dying in Kampala. The species of Ebola involved is Bundi-Bujo, an older, rarer form of the virus with no vaccine or approved treatments. And it's highly contagious, transmitted through bodily fluids with a high fatality rate, especially in developing countries. Experts say stopping it will be a challenge. It's thought to have been spreading for weeks, and the true size of the outbreak isn't yet known. But the WHO says international borders shouldn't be closed yet, and New Zealand officials say the risk to us here is low. Ed O'Driscoll reports.
The DRC has been here before. This is the country's 17th Ebola outbreak in 50 years. But cases now are rising quickly, and it's unclear how long the virus has been spreading undetected.
Currently, I'm on panic mode because people are dying. I don't have medicines, I don't have vaccine.
Local hospitals in the Ituri province are doing what they can, though they're not equipped for a major outbreak.
Donc ce n'est pas une maladie mystique.
This is not a mystical disease. Make yourself known so that you can be taken care of and so that we can prevent the disease from spreading.
But in neighbouring Uganda, fears are growing after 2 cases there, one of whom died.
Me as a Ugandan, I'm really frightened. I'm worried, I'm scared.
The strain hasn't been seen in more than a decade. In 2 previous outbreaks, it killed about 1/3 of those infected. Symptoms can appear anywhere from 2 to 21 days, starting like the flu with fever and fatigue, before progressing to vomiting and diarrhea, in some cases severe bleeding. Experts are alarmed by the lack of a vaccine, and ongoing conflict in the DRC is making containment even harder.
So huge effort to get some vaccines tested and out there is the priority. The second is where this is happening. These are really hard to reach areas, mining towns, on borders, really vulnerable communities.
The WHO, while declaring an international public health emergency, says there's no need to close international borders. The global risk remains low, including here.
We don't have direct routes. People will probably be intercepted on the way. But it's also not airborne. So this is a virus that spreads through bodily fluids. So that's through really close contact with somebody who's unwell or someone who's died.
The world's still haunted by these images. The 2014 Ebola outbreak in West Africa, which infected almost 29,000 people. Cases outside the region were rare, mostly linked to travel, including medical workers who'd volunteered to help. Slowing this new outbreak will be crucial in the days ahead. Ed O'Driscoll, One News.